Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
The waxing exercise is composed of three basic shapes of the occlusal morphology simulated on the plaster slab. After practicing the basic shapes, the waxing skills are applied to duplicate a missing occlusal surface. The main objective of this exercise is to learn a rapid waxing technique. It is assumed that the student has a basic understanding of tooth morphology and has previously been trained in identifying different teeth. The first shape is a cusp cone rising to a cusp tip. The second shape is basically a cusp cone, which is extended to form a marginal ridge. And the third shape is also basically a cusp cone, which in this case is modified to form a triangular ridge with its characteristic convexity. The fourth exercise is replacing the missing occlusal surface. The replica above shows the exact contour for copying the occlusal morphology. The replacement of the missing part is accomplished by performing a series of small waxing steps. The cusp cone is the starting skeleton which forms the cusp tip. Additional layers of wax on the skeleton are drawn out to form the marginal ridges and the triangular ridges. The central fissure pattern is developed with secondary anatomy radiating from it. While waxing this surface, keep referring back to the replica above. Keep the flame, wax, slab, and instruments close together for efficiency during the waxing procedures. Before starting any waxing on plaster, a thin layer of white ivory wax should cover the future area. Overheat the instrument so that the wax soaks into the plaster. This prevents the wax structure from becoming dislodged later. Pick up the PKT #1 waxing instrument. This is used to form the cusp cone. Pass the instrument through the flame while concentrating the heat approximately 1 1/2 centimeters from the tip. Melt the wax with a heated bow of the instrument. On lifting, the wax clings to the instrument. Underheating will not melt the wax. Overheating makes it impossible to pick up the wax. Practice finding the amount of heat necessary to pick up an increment of wax. After picking up the wax, heating of the instrument may be necessary. For each cusp cone, rotate the heated PKT #1 in a circular motion to form the base of the cusp cone. As the wax chills, lift the instrument upwards to form a pointed cusp cone tip. To produce a fine tip, use the blunter end of the PK #2. Additional increments of wax may be necessary to copy the base width and height of the cusp cone. The two subsequent shapes are also started by first developing a cusp cone. White ivory wax was soaked into the plaster and the cusp cone is developed. In the case of the marginal ridge, the cusp cone is being completed. Wax increments are drawn out from the side of the cusp cone in a curve to represent a marginal ridge. Several layers of wax may be needed to exactly match the given shape. Minimal carving with a PK number 4 or 5 or reheating with the sharp end of a PK number 2 may be necessary. As in the previous two shapes, white wax was laid down and the cusp cone is formed. Note this movement of the instrument in drawing up the wax to the cusp tip. After completion of the third cusp cone, additional increments of wax are drawn out from the front of the cusp cone to produce a convex curvature representing a triangular ridge. The convexity is achieved by adding multiple layers of wax. The best finish is obtained by reheating with the sharp end of a PK number 2, but minimal carving of excess wax may be desirable.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.